Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune, and we process white cell counts, thousands of them over the years, and so I know all the reasons because of which a white cell count could drop and what is a dangerously low white cell count. The first thing you need to know is that a normal total white cell count is between 4,000 to 11,000 per cubic millimeter. That's the normal range that we find, especially in adults. Before we get into what is a very low white cell count, what you need to understand is that the total number of white cells in the blood are generally made up of something called neutrophils. So most of the white cells are actually a type of cell called the neutrophils. A smaller proportion is something called the lymphocytes. So the neutrophils are the ones which you see, which I've drawn in blue and purple, the three of them, and the lymphocytes are the tiny little dark blue dot. So when we look at the white cell count, we're actually mostly correlating it with the number of neutrophils because they make up almost 70% of your white cells. Right, so what is a low white cell count? Well, if the total number of white cells is less than 4,000, that is low. But if the number of neutrophils is less than 1,500, that is also low. And if the number of lymphocytes is less than 800, that could also be low. Now we are going to focus more on this number of neutrophils being less than 1,500 because that's where the problems really start. So what is a low and dangerously low total white cell count? So you find that I've included the grades over here. Something between 3,000 to 4,000 is considered to be mild. Between 2,000 to 3,000 it's moderate. Between 1,000 to 2,000 it's severe. And anything less than 1,000 is considered to be extremely low, and it could also be called agranulocytosis, where there are almost no white cells to be found. So what is the most dangerously low white cell level? How is it defined? Well, anything in which your total white cell count is less than 1,000 or your absolute neutrophil count, which make up the majority of the white cells, are less than 500 is called a dangerously low white cell or a white blood cell level. Here are some symptoms that you're going to see if the white cell level drops below 1,000 or the absolute neutrophils are below 500. Some symptoms that we see in the mouth are called stomatitis. This is basically an inflammation of the angle between the lips, which is the corner of your mouth. You might develop swelling or infection over there. You might also have gingivitis, which is basically infection or inflammation of your gums. In the intestines, we are going to develop something called colitis, which is basically an infection or inflammation of the lining of your large intestine. Secondly, you might also develop something called perirectal infection, which is the place from where the feces pass out. That is called the rectum. You might develop infection or inflammation right there. In the hands, you might develop something called nail infection, which is a swelling under or around your nails. You may also develop furuncles, which are basically these tiny boils that develop maybe on your neck, face, or even on your hands. They get infected, inflamed, and are very painful. You may also develop ear infections, which are very common when the white cell count drops this much. Lastly, when the white cell count is low, like 1,000, or the absolute neutrophil count is below 500, you are also at high risk for fungal infections as well as infections of the chest, which we call pneumonia, and sepsis, which is a situation in which the bacteria enter into your bloodstream itself. This is really dangerous and needs admission.